All right. I appreciate it. Trying to look around here and manage a couple different screens. So appreciate everybody that has jumped on and joined us today for the Central Region Open House for MPTC. We always enjoy making sure that we get this put into the rotation before every single match cycle, just to get some information out to a lot of interested parties. So we do get quite a few applicants. And we've learned over the years that making sure that each region gets to be highlighted in some form or fashion and making sure that we all get to talk about our prospective sites as we move forward is always a real benefit for everyone that's applying, as well as just networking among the groups that we have together on this call. So I want to welcome everybody to the open house for the 2025-26 application cycle, and welcome. So generally, I know that a lot of people sign up for these, and not everyone can attend in person. I know that we're across multiple time zones, and we're always trying to fit this in the middle of the week. So we also know that everybody's pretty busy. So we have recorded this, and if you are watching this as a recording, thank you so much for watching the recording and making sure that you learn more about the Central Region. So today, just as a very quick agenda, I will be running through just a very brief history of MPTC, or the National Psychology Training Consortium, walk through a little bit about who we are as a consortium, as an agency. I'm then going to turn it over to a representative from each one of our sites to tell us a little bit more. We'll have some information on the screen, but we'd like them to tell us a little bit more about their sites, to explain about what the internship experience might be like at that location and what the life of an intern is like there. And after we wrap those up in about a 2, 3, or 4 minute introduction to sites, we want to open it up to those of you who have joined live to submit questions, and we'll get those answered, whether that is specific to a site that we have or whether that's general to MPTC or Central Region. We'll make sure that we leave lots of time open for that. I also know that some of you that have joined us, as well as some of you that may be watching this recording, did submit some questions as well. We're going to run through some of those questions, those pre-submitted questions, if there aren't a ton of live questions to answer. And after we kind of have a good panel discussion on each one of those, we'll make sure that we wrap up in plenty of time for any kind of summaries that we might need to get in place for everyone. So welcome all. And we'll get started really quickly with what MPTC, who we are, and what we do. Let's see. So MPTC, as a national training consortium, was previously named the Heart of America Psychology Training Consortium when it was founded in 2003. And so the consortium and the workforce was put together through a workforce development grant in 2003. With really the focus being on underserved and rural psychology. So these areas of focus in the state of Missouri were usually out into the rural areas, but we have since started to look into more underserved areas, whether that's a metro area, a rural area, but our mission remains the same, and that is to make sure that interns coming into the workforce have a good experience with us and what rural and underserved work in this field looks like. But not just that, we really hope that as an intern that you fall in love with our sites and you fall in love with these areas and you fall in love with the clients and you decide to work here full time. So whether that is within the area of Missouri in the Central Region, or you go to one of our other regions, but that you find a lot of passion and a lot of worth in the training that you have in rural psychology, and that you carry that on. That's the purpose that we hope to foster here. Our mission specifically is training tomorrow's psychologists in the discipline and practice of psychology with rural and underserved patients as a result of that. Really, we accomplish this through the scholar practitioner model, and we implement this through a local clinical scientist implementation. And so what we mean by that is all of our sites really give you the basis to have a generalist knowledge before you leave. So you will leave this program as an intern with a skill set necessary to really practice generally in the field of clinical psychology. What we also want you to do is really understand that local realities impact the way in which we practice. And so what we do is we ask that our students and our training and our sites are really focused on gathering population data from the areas in which they work and making sure that interns think critically about the way they're applying their skills. So this isn't just a regurgitation of what you've learned in school, This is not I practice or I give this assessment or I do this orientation because my supervisor told me to. It's the ability to think critically about why am I applying what I'm applying to the person I'm applying it to, and what is best practice for this local area and these local realities. And so that's what we really want to do, is develop an inquiring mind in our interns to kind of think through why they're doing what they're doing, and also to think about innovation and creativity in that mindset, and the mindset of how do we better our practice in these areas. And as a lot of our sites will talk about, we really value intern input when it comes to that. We know our interns come from all over the globe. We have international students and all across the United States that join us, and they each bring a perspective that we want to bring into our clinical practice as well. And so we want to make sure that not only do we help you understand how to practice wherever you do end up practicing through this type of model, but that our sites can learn from you and bring that knowledge back to where you were practicing for the year of internship and hopefully beyond. Just to give you an idea of how successfully we've done this workforce development and applied these practices, right now within the Central Region and MPTC, our alums make up about 72 of our active supervisors within the consortium. Our training directors at each one of the sites, we have 7 that have graduated through our program and are now training directors with the consortium. Our board members, we have 4 alums on our board of directors, and we have a training director, which would be myself, Dr. Dustin Brown for the Central Region, but we have multiple across our regions that do have one that has graduated directly through the MPTC pipeline. We also have leadership throughout MPTC, but one specifically that is an alum of MPTC, and our didactic presentations. And so you will learn that we bring in speakers from all over the globe to teach our interns on a weekly basis about specific orientations and fields of practice within the field of psychology. And 68 of those graduated our program and come back to teach our interns as well. So not only do we really hope that you come for an internship, we want you to see that there's opportunity regionally, there's opportunity within our sites, and there's opportunities within the consortium to really maintain this network of great people around you and continue to thrive in this environment. All right, just a quick overview of what we're talking about today. The Central Region, which as the Regional Training Director for the Central Region, I always say is the best region. But you can watch all the rest of the recordings and join the other open houses and make that call for yourself. But you'll probably find the Central Region is the best. Don't tell any of the other regional training directors I said that. But we have been accredited by the Commission on Accreditation of the APA since October 25th of 2003. You'll notice that we have been unaccredited but surviving much longer since 2003. But once we pursued APA accreditation, we received that, and we do it well. And so with our last site visit that we had, we got a 10-year renewal, which is the maximum renewal for our region for APA accreditation. So we will be under APA accreditation through the year 2032, and that seems like a long ways off, but it'll be here before we know it. Again, we were founded in 2003. So far, just specifically for this region, 416 individuals have gone all the way through our internship program and are licensed psychologists in the field of psychology. And those are pretty good numbers where you look around the country at internship spots. This is what we dedicate our time to and our resources to, and we do it to the maximum capacity to make sure it's a great experience. In addition to that, we have 27 interns right now that are currently placed in this specific region, and our region right now is made up of 5 different sites in the state of Missouri. Although Central Region, you'll see we do have inactive sites that may be surrounding the state of Missouri. Right now, our active sites, there are 5. They are all within the state of Missouri, and that includes Clark Center, Compass Health, Pearl Behavioral Health, Royal Oaks Hospital, and University Health. And we're going to learn a little bit about each one of these sites as we move forward through the slides. And so with that, I'm going to turn it over to our cohort over at Royal Oaks Hospital. And you can see some information on the screen here. Also, please note that there are QR codes at the bottom of each one of these slides. Feel free to scan those. Not only do we have a ton of information on our websites, which we'll talk about in a little bit, But we do have this QR code that if you do see something while these individuals are talking and you want to learn more immediately, please scan that down in the corner and learn more specifically about those sites. But as we do that, I'm going to go ahead and turn it over to Royal Oaks Hospital to talk about their internship program.
All right, thank you very much, Dr. Brown, and hi, everybody. Very excited to see and meet with you all and answer your questions later. I'm Dr. Patrick Fletcher. I'm a trained director here at Royal Oaks Hospital. And as Dr. Brown mentioned, I'm one of those alumni of MPTC, so they couldn't get rid of me. So I've been here since 2018. So if I could talk a little bit about Royal Oaks Hospital, and of course, I know that I'll be glad to answer any questions later on. But it's been our mission to inspire hope and promote wellness. We have a 54-bed acute care inpatient facility located in Windsor, Missouri. This is a pretty rural area, so the bulk of the folks that we take care of are, from rural populations. Right now, we treat individuals aged 3 to 17. I mean, 3 would be pretty extremely young. For the bulk of it, probably 7 or 8 to 17 would be the bulk of our patients. When you're at Royal Oaks, if you were to do the traditional track or the full time, you'd be on one of our rotations. So we have pre-adolescent, adolescent substance use disorder, and then psychological testing rotations that you would cycle through. But then you could also be part of our team on the dual track opportunities, which we'll talk about a little bit more later. But in those cases, you would split your time with us and then some time in the community doing outpatient. So like I said, I think that's the only slide we have for Royal Oak, so I'm happy to answer questions later. Thank you.
Thank you so much, Dr. Fletcher. Yes, and as you have questions, please take note of those per sites. We'll open up those questions here after we have each site introduce themselves. But also feel free to throw any questions that you might have into the chat. Amber, who works with us here at MPTC, will be monitoring that for me because I can't see everything, even though I have lots of monitors up. So we'll be monitoring those as well. But as everybody introduces themselves, if you do think of a question, feel free to throw that into the chat. And when we get to the Q&A portion, we'll make sure that we follow up with that as well. Thanks, Dr. Fletcher. All right. Moving on to the Clark Center.
Hey, everybody. Can you hear me okay?
Yeah, we got you, Dr. Zach.
All right. Well, my name is Dr. Matthew Zach. I'm with the Clark Center. This year, I'm one of 2 co-directors for the training program at Clark Center. Next year, I'll be the director for the Clark Center's internship program. We're a certified community behavioral health organization. We offer comprehensive outpatient mental health services to residents of Southwest Missouri. We cover Berry, Lawrence, and Dade County. All of our offices are rurally located, and we definitely focus on serving rural and underserved populations. Here at Clark Center, we do quite a bit. It's a pretty well-rounded experience. We have outpatient therapy, school-based therapy, psychological assessment. We also offer psychiatric medication management, substance use treatment, crisis support services. We have case management and peer support services as well. Pretty diverse staff. We're made up of psychologists, counselors, social workers, nurses, nurse practitioners, psychiatrists, and a lot of other behavioral health staff as well. As far as the internship experience at Clark Center, we get to work with diverse populations. Interns get to participate in individual therapy, some couples and family therapy. Psychological assessment is part of the internship throughout the entire year. School-based therapy services are also part of our internship program. And then interns have the opportunity to engage in some crisis intervention, kind of opportunistically, substance use group treatment, community psychoeducation. There's a lot of interdisciplinary collaboration also at Clark Center. And then all interns have the opportunity to get some exposure to PCIT and EMDR as well. As far as working at Clark Center, we think it's a great environment. It's comfortable, it's collaborative, it's collegial. We value our interns as peers. I think we do a good job balancing professionalism and camaraderie. And a lot of interns who've been through Clark Center have described their experiences being challenging, enriching, transformative. Let's see. I think I covered the slide pretty well. Yeah, I think that's about it. We'll take questions later on.
Appreciate it. Thank you so much, Dr. Zach. All right. Okay, keep on moving through with the introductions. And our next site that we have up is University Health out at the Kansas City area.
Right. Hi, I'm Dr. Ashley Jones. I am the training director here at University Health. We are located in Kansas City, so we are not a rural area, but we do serve the underserved. One of our missions here at University Health is serving everybody regardless of their ability to pay. So we serve the underserved here. We are a CCBHO, and we're also a large academic medical center too, tied together. So that makes us kind of interesting. We see lots of different areas, lots of our population need that service. So we offer 5 different tracks here. We have one specifically in our inpatient hospital. We serve adults 18 and above in our inpatient unit. We have 3 outpatient tracks. You'll serve specific populations, one with adults, one with children, and then one focused specifically on women's health and women's health issues. And then we have one in our family medicine hospital in our integrated BH track. So each track does a little bit different things for their training opportunities, but overall, everybody will have options to do individual short-term therapy. We're big believers in consultation, so we do all kinds of consultation with different treatment groups, and then outcome measurement, and then some specific tracks do group therapy as well. So I think that's all of it. I forgot to say at the beginning too, I'm also an alumni of MPTC, so Dr. Brown was telling you the truth when he was saying most of us have stuck around. So we do believe in keeping people in-house, and our goal here at University Health too is kind of keeping people. We've kept some of our interns last year too, so we do believe in that. So good to see you here, and can't wait to answer some more questions.
Thank you so much, Dr. Jones. Yes, as you will hear multiple times. We hope that you will stay and you will see it. And that's one of the best things about the Central region, but our network of regions as a whole is just the ability to say, hey, even if my internship spot was not where I want to land for the rest of my training for a provisional license or for residency training, we've got multiple landing spots, but a lot of individuals really do just find that ease into a postdoc position or beyond with their site once they understand how well those systems work in the areas that they work. A lot of people fall in love with it, so appreciate that very much. All right. Next up, we have Burrell Behavioral Health.
Hi, everybody. My name is Jean DeBenny. I'm a psychologist and the training director for Burrell. And you may notice our name changing here in a couple of months. So you may start seeing Centerstone instead of Burrell. We're going to be going through a big merger. So if you're looking for us during the application process, keep an eye out for Centerstone in Springfield, Missouri. So we are a large certified community behavioral health organization. We serve just about everyone who comes in the doors. We take, Medicaid, Medicare, a huge list of commercial insurances. We offer services for free. We do sliding fee scale. We have grants, the whole thing. So we are definitely focused on serving the underserved. A lot of folks in our community have difficulty accessing care, and we want to make it as easy as humanly possible. We have really focused on reducing our wait list. So now we are down to less than 30 days to get people into care, which we are really excited about. And I think speaks to our mission and our core values, where we really want to be the best place to work and the best place to receive care. So we have a huge range of services in that spirit, and ranging from crisis to outpatient services to residential programs. But our interns are primarily based in our outpatient department. And even within outpatient, there's also a huge variety of service lines. We have our recovered eating disorder services. We have our focus clinic, which focuses on integrated ADHD assessment and treatment. We have our autism center that focuses on ABA and behavioral interventions and autism evals. We have our Age Well service line that focuses on chronic pain and working with older adult therapy and presenting problems for older adults. We have a trauma service line that focuses on EMDR and various trauma approaches. We have group services. We have a Fidelity Model DBT program. And our interns focus primarily on having a general outpatient experience that we hope will prepare you very well for whichever direction you want to go in with your career, whether that's within community mental health or another area. That's one of the advantages of being at our site is you will get a wide, diverse range of experiences and you'll work with a huge range of clients. And you will leave internship feeling much more prepared for the folks that you will meet with in the future. And a number of the service lines that I mentioned are also part of our mini match program. So interns at Burrell have the option to do a general outpatient internship or to participate in a mini match rotation where you can specialize in some of those services that I mentioned. So if you want to focus or develop a niche area, say for eating disorders or ADHD or autism or any of those things, then we can help you do that.
Thank you so much, Dr. Bowman. Appreciate it very much. All right. Let's see. Now, we're going to move back to the Compass Health Network, but this time we're going to talk a little bit more about the other opportunities outside of Royal Oaks Hospital. So who do we have on? I don't see the side. Who do you have for the rest of the Compass Network?
Dr. Brown.
There we go, Dr. Webb. I knew you'd be in there somewhere. I appreciate it. Just didn't see you on my face bubbles. Have at it, Dr. Webb.
No worries. Hi, everybody. We're glad to see you here. I am another one of the retained interns. So I was in the Central Region, actually one of the offices I now oversee. And so if that logo up at the top looks familiar, Compass Health and Royal Oaks Hospital are sister organizations. And so we do have the same mission there. We are a nonprofit community mental health center like many others here. And so when we think about training opportunities within Compass, we kind of are the epitome of kind of that generalist approach. And so we have our outpatient traditional track, which can be kind of catered to what it is that you're looking for, depending on the site that you might end up at, because we are spread across the state. And as you might imagine, those different sites might have different opportunities. So that might include DBT, that might include training in PCIT. This year we are training all of our interns at the ADOS. We've got ACT-T programs, school-based therapy, a focus on child and adolescent work, depending on what location you are in. And so depending on what you're looking for in that traditional track, we certainly have lots of options to do that. I'm going to skip down real quick to the dual track. So that would have those same opportunities, but you would spend 3 days a week at Royal Oaks Hospital and then 2 days a week in a Compass Health outpatient office. So that really gets you the opportunity to experience both inpatient and outpatient. And I know a lot of our alumni have found that really helpful in figuring out where their passion lies moving forward in their career, and also gaining skills from either location to be able to apply to the other and wherever they land. And then last, we also have that is new for this current year. We have our first intern in this rotation this current year, is our autism spectrum disorder track. So our Rolla office has an autism center. So that location specializes in autism assessment and treatment, and really a team-based approach. So having a case manager, other psychologists on the autism team, with the goal really being to see young clients quickly and fill service gaps. So in this track, for example, interview and psychological testing occur the same day to reduce barriers and provide feedback really as soon as possible. Opportunities in training with parent-child interaction therapy, pivotal response training, and we have plans to expand into parent groups and other services as well. So really the hope is that we're able to find something that you would really like to get experience in across all of those generalist opportunities at Compass.
You button kept trying to slide away. Thank you so much, Dr. Webb. Appreciate it very much. All right. I am going to go ahead, I believe. Yep, we are through with our introductions. And so what I want to do is be able to bring it back to the group. I'm going to throw a few things, or let's see, I'm going to throw a couple links into the chat for everybody to look at. Both of these documents can be found on our website. And what I'm putting into the chat right now are some helpful links and PDFs about what an application process looks like for our region. So you keep hearing us talk about regions, you keep hearing us talk about multiple sites, and some of our sites have multiple match numbers or rotations. And one of the best things about applying to the National Psychology Training Consortium is one application of the so many that you get during the APIC portion can apply to any of these sites, and multiple sites at once. And so while you are applying for a site, you can specify those match numbers of the specific areas where you might find interest. But please know that you get a lot of bang for your buck. And in your cover letters, this is why cover letters can be very important when it is very specific to your site. Please recognize that you can talk in your cover letter about some of those sites or multiple sites that interest you or why you were interested in those sites specifically. And so we're able to then talk to you specifically about those rotations, but during the application process, you have the opportunity to apply to multiple spots with one application. And so that's a really great benefit. It's also why it's important to understand everything that you can about all the sites within all of our regions, because you are able to apply regionally to multiple sites as well. So please see the links in those. Those talk about how to apply within a region for multiple sites and kind of walks you through that process. And it also gives you in the next link a little bit more about our application or the application process in general, and then how we process applications as they come in. So if you do have any questions specific to that, we'd be happy and more than happy to welcome those and talk through those. But please know those resources are in the chat, and you can also find those on our website for potential interns and candidates. So, knowing that we do have some that have joined us, some applicants or potential applicants that have joined us, what I want to do now is turn it over to the group. And now that you know all the sites that make up the central region, I'd love to open it up for any real-time questions. It could be site-specific, it could be general to MPTC, it could be general to practice of psychology within the consortium. But please take yourself off mute or throw a question into the chat. We'll give it a few seconds for you all to speak up or come off mute. And then we've also got some, like I said earlier, some questions that have been submitted from the group previous that we'll also run through and kind of do a panel style question and answer session as well. But I'd like to invite anyone that does have questions or comments to come off mute and ask those.
I had a question. It's about the dual track, but I think more geared towards Dr. Fletcher. I was curious with the tracks, if you could do a mix of, let's say, adolescent and psychological testing, or is it kind of confined to one track during that?
Yeah, good question. So when folks are at Royal Oaks doing the dual track, they usually get paired up with one of our units. So that might be like pre-adolescent or adolescent. But obviously within that, if you tell us like, hey, I'd like to spend some time working with the pre-ad, sometimes work with adolescent, that would always be fine. And then all duals will have to do some psychological testing. It'll be a requirement for everybody. So they also get access to psychological testing. They just kind of have to discuss it with me and plan it out, whereas the full-time interns have that as a rotation. But dual tracks would still do testing. Mm-hmm.
Okay, great. Thank you.
A great question. And Sue, as a follow-up to that, I also want to say what testing looks like across our site too. I want to mention that as well. So you've seen on a lot of slides that we talk about assessment, psychological assessment. It can look very different based on the site or the placement within that site as well. So we do have each one of our sites offering different ways in which assessment is done. And sometimes, as Dr. Fletcher had mentioned, that might be in an inpatient hospital setting, where it's going to be much more restricted in the amount of testing that you do in that time-limited atmosphere, and it's much more of a brief consultation with additional testing materials put into that. And then other sites that have an outpatient assessment rotation, at Clark Center, at Borough Behavioral Health, at Compass Health, they all will have more of that complete battery, or it might be specific to an autism evaluation or an ADHD evaluation. So if you do have an interest in assessment, know that each one of our sites does provide an availability for assessment in some form or fashion, but it could look very different than a 12 to 15 page full battery that you might be used to coming out of an academic setting as a testing battery. So if you do have questions about testing, again, feel free to come off mute and ask those as well. But those are a lot of good questions to also ask specifically of the site if you are very interested in that assessment portion as well. So thank you for that question, and thanks for the answer, Dr. Fletcher. Anyone else have any questions right now for our sites, our training directors, or our supervisors?
Yes,
Oh, yes, very good.
hi,
Go ahead. Yes, go ahead.
I do have a question for the University Health Center. They mentioned they offered 5 tracks. Do we only need, I wasn't sure if we only need to choose one or it could be multiple tracks.
Yes, that is a great question. So we have 5 interns total, so we will have one individual for each track. So there is not going to be any moving between the tracks. When people are applying, however, if they're interested in multiple different tracks, they definitely can apply to each one, and they can set up interviews with each of the supervisors. So, but each track is one specific intern, and they'll stay there throughout the year.
For the integrated behavioral health track at University Health, what clinics are available at the hospital for working in?
That is a good question. It is within our family medicine clinic. So they see kind of a lifespan throughout the whole family. Most of the time they're working with more adults. There are a few kiddos that pop in, but it's within the family medicine clinic.
Any other open questions? I know that we have one in the chat. I can throw over to that while everyone else is also waiting. And so we did get a question about SPMI and how that's handled at the site. And I would say that SPMI is probably something that is handled almost by every single individual of these training directors that come through. And that is kind of in the nature of doing the underserved or the rural populations, as we tend to see those that sometimes don't have any other means of getting except for a safety net network. And that's what a lot of our sites provide. So I will say that that's probably will be weaved into every experience that you would have in the central region. But I do know that some of our sites do have some specialty rotations in that and a little bit more emphasis in that. So I'd invite any of our training directors to come off mute and maybe talk a little bit more about how SPMI kind of fits into the way in which the training program works. Anybody want to handle that one?
I don't know that I would say that Compass specializes in SPMI, but I would say that it is very common. So we see a wide range of severities and diagnoses, but I would say that the severity skews a bit more severe. And so that being said, we've got a range from things like adjustment disorder through personality disorders, PTSD is very common, and schizophrenia, things like that. And that's along with our case management program as well. So you would, if seeing clients with SPMI, would not be seeing them in isolation as their only provider. There would also be additional support as part of a treatment team as well.
Thank you for that, Dr. Webb. I will add to that because many of our sites are community mental health centers, as I mentioned earlier, become those safety net networks. That is woven into the training and the education that you get, specifically from a PTC as well as on-site training. That those chronic illnesses and those persistent illnesses are commonplace for everyone working their way through it. And so that's why we also emphasize additional didactic training in this area and on-site training as well. I do know because of community mental health designation among many of our sites, the hospital designation or rural hospital designation among many of our sites, that is also part of the rules and regulations that they operate under, is to make sure that they are monitoring that. And so many of the sites would be working hand in hand treatment planning wise with case managers, as well as an integrated team around that. To make sure that things like assertive community treatment are running really, really well, but also that we're having a complete and holistic picture of individuals all the way through treatment and discharge. So it's a really great spot to land for that. Just with the emphasis on rural and underserved, generally we do see a higher percentage of that population coming through the doors at each one of our sites as well. Great question.
I'll also
Anyone
kind
else?
of, oh,
Yes, go
I
ahead,
have one
Dr.
more
Jones.
thought. Sorry, Dr.
Yeah.
Brown. To
Mhm.
add on to that, I know your question was kind of like the training around working with this population, and I agree with Dr. Webb. We have a wide range of populations here, but I think everyone within the consortium works from a developmental model, especially here at University Health. So part of that is kind of offering the training to you and making sure you know what you're doing before we kind of throw you into the fire. So I think that's part of that. The training will be provided and kind of like making sure you know what you're doing, and then having you shadow and observe and before you're out on your own too. So I think that that is part of the training process as well that I just wanted to speak to.
Love that. Thank you for that addition. And while we're on that, one of the things that we haven't touched on yet or gotten a question about yet, but that you just touched on with the scaffolding model of exposure and then moving into some of the independent practice an intern would do. I'd really like to open up to anyone to kind of talk through your supervision model. How does supervision work at your location, and how do you all pair, match, and make sure that that's a good experience for the interns? Anyone want to jump off and talk about their supervisors?
Yeah, so I can speak to at Royal Oaks Hospital. So yeah, I've been supervising here for several years, and as training director to also meet with the other supervisors. I think the general consensus around here is we take kind of a scaffolding approach. So we'll kind of discuss it in supervision, and then you can observe us do the task, and then we'll observe you do the task. Then we can review, ask questions, and see where you're at. And then, if you feel confident and good enough to, run whatever that task is, then, you're good to go. I think our model over here is working y'all towards like independence, but, still providing, that oversight and that guidance, and maintaining availability. So here at the hospital, I'm somebody who has, basically like an open door policy. So if it's not your supervision time, if I'm not your supervisor, but you have a question and I'm around, then please come ask me and let's figure it out. Or if it is something more serious, I need to direct you to your supervisor, that's fine. But, if you have a question, I don't want folks walking around, with not knowing what to do, especially if I'm available and can answer your questions. So, our supervision style over here really is trying to, rising tide raises all ships style. So we understand that it's a time of learning, so you're allowed to make mistakes. We just obviously encourage it towards correction and competence in the field. But yeah, I hopefully that answers the question from Royal Oaks perspective.
Sure. Any other sites want to talk about their supervision or how that looks? I know it'll be fairly similar because we do have a lot that we ask of our supervisors, but would love to hear any other perspectives of anybody that wants to come off and kind of talk about supervision at your site.
I would just add from the Compass Health perspective, we are, as I mentioned in kind of the intro, we are quite large and have a variety of locations. So we're not as able to do kind of a personality match with supervision, since we are more location locked. You apply to a certain location within our system. However, we do all take that, scaffolding model. I know that that's probably overused, but it's an important model. And so we all as supervisors take that approach to make sure that you're comfortable and we're not just throwing you into the deep end. That's certainly not what we want to do. But I would just like to say that if you are able to apply to Compass, interested in applying, one of the things that we do in our interview day is a kind of meet and greet with different supervisors, because I know that that fit is something that is important to lots of folks. And so you'd be able to talk with supervisors of that location, of that rotation, so that you'd at least have an idea of kind of what that experience might be like. So just wanted to throw that out there.
All right, Dr. Webb. Along those same lines, supervision goes both ways. And so of all the core competencies that we look at, we follow APA's 9 core competencies that you're evaluated at throughout your internship. And that's how we rate you as ready for independent practice at the end of your rotation. One of those areas is supervision. And all of our sites have some different takes in the way in which they help develop you as supervisors. And some of that is within individual supervision. Some of that is within some group and mock supervision environments. And some of that is with some actual supervision of practicum students, other like licensures. So I'd love to hear if there's any supervision opportunities at your site. If you could tell us a little bit about what it's like to actually have interns supervising at your site, I think it would be great to hear.
At Clark
So,
Center.
go ahead, Dr. Brewer.
Yeah, go for it. Dr. Brewer?
At Clark Center, we do have some master's level interns and some placements where our interns will have an opportunity to do some supervision there. There is some mock supervision. They have a group supervision with a psychologist, and so they can practice there. I like to view them also as participating in an element of mutual supervision because we both learn from each other. So it is a very collaborative relationship. I learn as the intern learns, and I want it to be that way because we are all incredibly important components to the supervision process. It is very collaborative. It is primarily focused on developing skills, but because oneself to me is the most important tool in the therapy room, there will be some focus on areas of individual growth that may be concerned, not individual therapy, but some crowding there, some challenging there to help individuals become overall rounded and then apply that with other people with whom they might work in the future.
Love that answer, Dr. Brewer. Dr. Vinny, I thought you come off mute.
Yeah, thank you. And I'll try to answer both questions at once related to supervisor pairing and intern supervision opportunities. So we do try to pair based on interests and goals whenever possible or whenever it's relevant. So typically before I pair interns with supervisors, I'm reviewing APPEs and essays and things like that to identify some key interest, or I'm emailing incoming interns to see if they have preferences or if there are areas that they really want to focus on or explore throughout the year. And then if we have supervisors who match some of those key interests, then I try to make sure that they get paired together. So for example, this year we had an intern who, a couple interns who were really interested in autism. So I made sure to pair them with supervisors who are very well versed in working with autistic folks. And similar for like mini match pairings, trying to make sure that we're pairing based on interests, and some of those key conversations with supervisors happen really early on where we are very openly and proactively discussing what would you like your internship year to look like? What are some experiences that would be really valuable for you to have this year? And then identifying how we can make sure the interns get that experience. It's one of the benefits of having all of these services and service lines under the same roof is that chances are if you have an interest in anything related to outpatient or intensive outpatient services, we can get you connected. And then related to intern kind of prac supervision or vertical supervision, that's actually something that we are going to be implementing much more effectively this year. We have a partnership with Missouri State University where we have prac students who come over every year from there, and we did their onboarding together this year, which was really exciting. We got a lot of positive feedback about onboarding prac and intern prac students and interns together this year. And we've already got some folks who are like, hey, can we do peer supervision? Can we create some intern prac supervision opportunities? And we did a kind of get to know you activity in one of our onboarding events. And already in my head, I'm like, these two need to do supervision together. Like we were trying to, the group activity was like trying to find commonalities, and they both like had gone sandboarding, like in the desert. I'm like, that's just too interesting not to connect you to. So we're focusing more intently on that this year. So that will be an option in future years as well.
Good luck with that. And then anyone else want to talk about supervision or the supervision of interns to other disciplines? And if you have any questions specific to any sites about how they have supervision structured, please feel free to reach out to any of the training directors afterwards to ask those questions as well. And I know we've got about 10 more minutes left, and so I definitely don't want to skip any other chat questions that do come up. Still feel free to put those into the chat or bring yourself off mute. But the way that I want to make sure we have plenty of time for is to also give you some idea, just as Dr. DeVinny was talking about personal matches and good fit for supervision. It's always nice to be thinking about, are you a good fit for the central region? Are you a good fit for the site? Are you a good fit for the MPTC consortium as a whole? And so what I really like to do is, if each of the training directors, I know there will be a lot of overlap, but if you think of anything that might be unique about what makes an applicant a successful applicant, what in their application makes them successful for you to look at, but what other kinds of characteristics of an intern are you looking for when you are doing those interviews and making a goodness of fit decision for match? What kinds of things are you looking for those interns? And so, in fact, what I will do is, Dr. DeVinny, I'm going to go in order, and I'll put you on the spot first to kind of give us some insight to that, and we'll just kind of run through very quickly from each one of our representatives to give us a little bit of an insight about what you're looking for in applications and interns that apply for the site.
Sure. Thanks for keeping us focused and structured, Dr. Brown. So I know some things that there are not a lot of things that we really require of our applicants that, you know, if you don't have this, we're just automatically ruling people out. We know that intern applicants have had a huge range of opportunities, and some may be more limited than others based on their program partnerships and, you know, accessibility of sites and things like that. So ideally, just as far as like logistics, ideally intern applicants would have some type of evaluation, testing, assessment background. Even if you haven't had a lot of opportunity, at least some eval experience will help you be successful at our site. And then certainly if you've worked in community mental health before, that would be hugely beneficial, but isn't a requirement. And one thing, just to give like a little like inside scoop for interviews, one thing that I love to see in interns is just owning that you're nervous in the interviews. Like, we're all mental health professionals. It is okay to feel nervous and just say like, you know what, I'm feeling kind of nervous about this. I'm gonna, you know, just take a minute to think about that question, or can we go on to the next question and then circle back to this one when I can think of some examples. Like, that is okay, and that's actually really fantastic if you have that level of confidence and just professional maturity. So hang in there.
Thanks, Dr. Webb. Hey, Dr. Webb, you are next on my list, so I'll put you on the spot for anything in addition to that.
Sure. I do love interns just applicants naming that you're nervous, because I think that helps kind of contextualize it for you as well. Like that has nothing to do with kind of your preparedness. You just are nervous. It's a big deal, and that's okay. So as far as Compass goes, we really hope for interns to be flexible or adaptable. We have a lot of moving parts. If you've ever worked in community mental health, we have a lot of programs. There's a lot of trainings, a lot of pieces of paperwork. So I would say flexibility, and then some kind of organizational system to help keep track of all of the pieces of paperwork that go along with working in community mental health. And then the other two I would add is openness to feedback is really important to us, because we as supervisors are certainly open to feedback as well. And for some, this might be your last year of supervised practice, since you can get licensed without a postdoc now. So being willing to hear areas of improvement is important to us. And then last, I would say being able to work both independently and as part of an interdisciplinary team, which sounds kind of like they are opposed, but they're not in community mental health. So being able to balance both of those things, I think is a strength for the folks that are successful at Compass.
Great. Thank you, Dr. Webb. Dr. Jones, I have University Health up. Anything you'd like to add to that?
Dr. Webb took mine. I was also going to say flexibility, so I can agree. I think that is a community mental health requirement. You need to be flexible. They love to change things on you. I also would echo and everything else everybody had said, but also add the ability to know when you need help and then to feel comfortable asking for help, I think is really important. We're big believers in kind of open door policy and asking for help, but we can't help you if we don't know that you need help. So being able to reach out if you need, I think is an additional quality we're looking for.
Awesome. Very good answer. Going over to the Clark Center, Dr. Brewer, Dr. Zach, anything that you'd like to add about what you look for interns or what makes them successful at Clark Center?
Sure. Let's see here. Pull up my notes real quick. So our interview style at Clark Center is a panel interview, which sounds really stressful, but we're actually really conversational, and it ends up being a pretty relaxed interview once people settle into it. So I encourage you to just bring yourself, like bring who you are. We want to get a sense of who you are as a person. Like we've already looked at your application. We already know what kind of skill set you have and experiences you have. We just want to feel out whether it's a mutually good fit or not between you and Clark Center. What makes people a good fit at Clark Center? I would say genuinely having an interest in working with rural underserved populations matters a lot, because that's the vast majority of what we do. We also have our own selfish interests in trying to prioritize candidates who at least have some potential of sticking around in the area, either in Missouri and contributing to our state's mental health treatment, or Clark Center specifically. As far as what makes interns successful here, really coming in with the understanding that the internship year should be and probably will be your most demanding training experience to date. Like it's designed to be hard. It shouldn't be a walk in the park. It's gonna push you and stretch you, because it's our job to prepare you for professional practice. So just a readiness to kind of take that on, but also being able to balance that with other important things in your life, and self-care also matters. If you're an intern at Clark Center, you should expect some level of change in your personal and professional self. You should be ready for constructive feedback that's intended to help you grow. Be prepared to have your biases explored and challenged respectfully. And that's true of whichever direction your biases lean. We're gonna look at those at least in some detail in individual supervision and in group supervision. And then overall, just having an ability to dig deeper and be vulnerable during supervision.
Love that answer. Love that answer. And lastly, Dr. Fletcher with Royal Oaks Hospital. Anything you'd like to add to that?
Yeah, if I can again echo, because I think it definitely deserves it. Flexibility at, acute inpatient is definitely a necessity. Just things at a hospital, will change, like, major directives. So, you've been trained to do it one way. Well, halfway through the training year, we'll probably have to ask you to do it a different way or follow a different rule. Nobody loves it, but it is, like a requirement. It'll be like a necessity. So I guess, the folks who are more willing to be flexible and accept that, and, who that doesn't grind against, I think we'll do, better at our site. And yeah, also, I know it's like a lot of repeating, but, letting us know when you need help. I've mentioned that, we try to have supervisors available at all time, even if it's not your direct supervisor, but letting us know what you need. And attention to detail, documentation at our site is pretty particular. It's obviously like learnable, doable. It just takes some time, and, you'll get some feedback, get some notes sent back for correction. So just understanding that's just kind of part of, learning, or, that aspect of internship, as well as, learning clinical documentation and stuff like that. So yeah, I think that's all I got. Thank you.
Wow, thank you so much, Dr. Fletcher. And thank you all for the questions that were pre-submitted. Thank you for the submission of some questions in the chat, and thank you all that did come off mute. I know that a lot of our training directors are dropping their contact information into the chat. And so please grab those if you would like to contact them any further. that is available on our website. And those links, feel free to reach out to us at, hold on just one second, I want to make sure I get the email address right, but it is applicant@psychologyinterns.org, applicant@psychologyinterns.org. If you have any further questions and we can answer anything that we did not get to today, or if there was anything that sparked a little bit more and you want to learn more, please email us directly. And if you don't have the contact of that training director, we will put you in contact with that training director. So really want to thank you all, both training directors, supervisors, as well as our staff and our interns, that the candidates that did join us today. Thank you so much for your interest in Central Region. Those that are sticking around for the Great Lakes open house, that's going to begin on this exact same link here in just a few minutes. We'll be signing off, but feel free to stick around directly here for that next session. And again, thank you so much for the interest in Central Region. We really look forward to seeing your appies come through this fall. And we're always here to help, whether you land in the Central Region or not. And so even if you find an internship at a different region within MPTC or outside of our region, we're still here and our sites are still looking for you as soon as you get done with your internship. You might only be able to get one internship in, but we have lots of experiences after that, both as employment, but as postdocs and residencies if you need that, and provisionally licensed psychologists. So don't count us out, even if you match elsewhere. Please look us back up. For those that are remaining on, learn more about Great Lakes. Thank you for sticking around, and everyone else, have an absolutely wonderful day. Thanks for joining us.
Thank you.